Hello and welcome to this week's episode of Olsem Wanem. I'm Florence John Duo. The rate of mothers accessing basic medical services during the time of pregnancy in rural Papua New Guinea is still very low. In this episode, we feature the level of assistance the United Nations Population Fund, or UNFPA, has provided in partnership with different stakeholders to women in the Southern Highlands province.
Southern Highlands province is home to an estimated 700,000 people. Over 80% of this population lives in rural communities, spread across mountains and valleys. The province contributes to Papua New Guinea's economic growth through the export of oil and gas in the Nipa Kotubu district. However, the standard of living in rural Southern Highlands in terms of reproductive health shows the stark absence of benefits that may be associated with a province which generates millions of kina through the extraction of oil and gas resources. In February, the province was hit by a massive earthquake measuring up to 7.6 magnitude. Hundreds of people were displaced, while many others were lost to landslides or related health issues. As part of disaster relief assistance, the United Nations Population Fund, a United Nations organization that focuses on improving maternal health and promotes awareness on reproductive health, conducted specialized trainings and donated numerous health kits, including medical items, to improve the state of reproductive and maternal health in Hela and Southern Highlands.
A number of reproductive health kits, which is mostly delivery kits. So we brought a number of quantities of delivery kits to ensure that the people, especially the pregnant women, get access. But at the same time, we also know that when we have emergencies and people start running away, fleeing, most of the women do not, get away with anything. So to help them restore the dignity, the UNFPA also provided 6,000 dignity kits.
Beginning with clinical management of rape, a 5-day workshop was conducted in selected areas and targeted key people in the health sector, particularly reproductive health. Dr. Caroline Kema from Yalibu District Hospital was a participant.
UNFPA has been really helpful. They provided resources as well as some workshop. So one of the training that they conducted was the training was not based on how to treat survivors of gender-based violence. So one of the training topic was on clinical management of rape cases, because during crisis situation, families are deserted, and we don't really focus on the survivors, because most of the time, even when the survivor is brought to the clinic in a normal setting, a normal situation, they are always brought to the facility for a medical report, or because the relatives want some compensation.
The CMR training was extended to nursing officers who work in the family support centers, including police officers who work in the family sexual violence unit. Julie Sako is a community health worker at the Family Support Center at Mendi General Hospital.
At least me black some contact law had a health center, so all in charges lab na samba or calling me bla all no clear long and me bla all calling me bla na me bla talks all bla making mosem because 1 week trainings also all no familiar, so all calling me bla na me bla, and then all refer more camera within the time frame. So at least I am on my improvement law training will come up. Me plus have a get known to other health co-workers from out of the districts.
For the police, dealing with victims of domestic and sexual violence can be challenging at times. But Police Woman Constable Trisa Kamawawa, who also underwent the CMR training, is at the implementing end, where she speaks to both the victim and the perpetrator.
In Southern Highlands, plenty of cases sa man sa paiti married to mas. So also talk property belong all since all putim pig money, so also talk all can paiti mall. So one advice misa give misa talk by law talk tambulo paitim narabla man. So you know that right lo putim handle and tablo dislike Mary because also human being and she has the right to. The other thing is they force their wives. They force their wives to have sex. So this la plenty all man all things it is their right lo for sim man the husband it is his right to force the wife to have sex, but through lo this la workshop me come to realize no God.
The Catholic Diocese in Mendi has played an active role in the disaster relief assistance in partnership with UNFPA and other church-run clinics operating in rural areas. Winnie William was instrumental in this partnership, providing the link between CDM and UNFPA. Having worked with the Catholic Church for over 18 years and a participant in the training on CMR, Winnie shares their experiences on the joint effort to minimize sexual violence.
We in the province in Southern Highlands and Hela, we are known for violence. We have been violent people. But when it comes to women especially, the care that is provided for them, it is more, they look at the compensation component instead of the welfare of the woman. So having that clinical rape management care, training for the health workers really boosted them on how they could care for women who are affected.
Welcome back to the program. The 7.5 magnitude earthquake that struck last year has affected access to basic maternal and reproductive health services in both Southern Highlands and Hela provinces. As part of UNFPA's Humanitarian program, they've distributed essential kits to mothers, young women and girls. The kits were distributed as far as Nipa Kutubu and Yalibu Pangia districts.
At the Yalibu District Hospital, the delivery kits were given to mothers who went for antenatal checkups. The delivery kits were for expecting mothers. It contains essential items that are needed during labor and until a few days afterward. Naomi Verape, a first-time mother, and Essie Sala, a mother of 4, were 2 recipients in Yalibu.
Abaste 30 mi using time samla santi nambat kama body blumi logan alright na now mi kerap na mi ran stop na now you black kame na body blumi light lig nambat na mi using all one man the models not one me time but one man mi alright.
Many women in Southern Highlands who had received the delivery and dignity kits had similar views about them. It encouraged many to come for antenatal checks and brought joy to those who could not afford new blankets and napkins.
We've been getting baby outside, loused, so been helping me, you've been giving me Logan, so me been one bell. So doctor been making Logan and outside land been making, you've been giving me Logan. So baby 3 days I'm trout na, 7 days Longan em ben kisit bebe kam lausi. Help him em go good.
In the Nipa Kutubu district, the relief assistance given by UNFPA was coordinated and distributed from the Pimaga Health Center. Esther Lewis is a beneficiary, and from what she received, she shared the items amongst other women in the community.
So this all bags in black simia. So we got something on mama na planty something on mama stuff. Kind of some models, pens, tones, thoughts, towel, soap, toothbrush, Colgate, all this like and all something. So I'm been start one time bla. Me bla use him good. I'm saving me bla. Okay, kind of small sample no got long em all. Ono been small bags. Okay, me bla scale mo sample pens. Okay, sample models. So me bla story lol can so you see more sem.
The third kit distributed by UNFPA was an STI kit. It contains condoms and medical items to treat sexually transmitted infections. Since the distribution of STI kits, the response by the community has been overwhelming. The Yalibu District Hospital has seen an increase in more people turning up to seek advice on STI-related cases, family planning, or reproductive health.
Some time also like me some na only misuse in medicine na only no kiss him good law. Time me like give him more time na stay away from partner. Lo sleep one time lo having sex one time can you stop long when because me plus supply medicine kiss him also all no kiss him now big it now misuse this like something him go west. Now he go infected. Now he go UTI, different drug infection. The bacteria go strong in belly button. Where place pignini form long into all no current pignini. So people work lo help him all give him then people work lo strong in Martian but Martian and no help him. Na condom does all him work lo help him na. People work lo look lo this like. Awareness miss I work him lo market na stop all gara it was all gara counselors word me work him awareness lo HIV na this like STI cases more lo only not clear good.
At Mendi General Hospital, Sister Margaret Kirap and a team of 7 health officers, including 2 support staff, work at the HIV and STI clinic. In 1 month, the clinic attends to at least 30 patients with STI-related cases.
People have been sought run for STI drugs, some HIV, all one some HIV drugs too one time, but then 3-5 months ago, people are helping me all drugs na me give him out all patient. Now me no got more now. Some condom tassel stop yet na me distributed part all STI drugs. Me need him, so me been give him out na me thank you straight long help him do it.
You're watching Olsem Wanem. It is stressful for medical officers serving in remote aid posts and clinics in Papua New Guinea, but it is more worrying when mothers deliver and are not able to provide the basic necessities for the newborn baby.
The Mendi General Hospital delivers at least 200 babies in 1 month, but it does so using very limited resources. Since it became a provincial health authority 2 years ago, the hospital lacks basic equipment needed for its labor ward. Sister Ruth Ether works in the labor ward and has been a nurse for over 28 years. In the last 5 months, a team has assisted hundreds of mothers who were affected by the earthquake give birth with the least complications possible.
The midwives receiving all this lang mama in labor, all by admitting all by checking all, kissing all get all like observations, all this blah, checking all whether I'm ready or carrying, all this plan I'm all midwives yet, also help him all. And if any like abnormalities, baby sleep across, malpresentations, that's the time they notify the doctor to come and help out.
Some mothers were fortunate enough to buy items for their newborn babies. Most of the medical items, including delivery beds used in the labor ward, have been used for over 20 years.
They are coming, and sometimes we really have sleepless nights, tireless, really tiring job we do, but how can we help? If there is control at the rural centers, then we can able to manage here, but we cannot send the mothers back when they are in our hands, in our care.
In attempts to promote safer maternal health for women in rural areas, UNFPA has provided sterilized medical items that will be needed when managing complicated pregnancies.
Disaster time, we supervised more mothers, more than 30 in a month, and with those equipments, it has helped us. Like before we received those equipment, we normally do just clean deliveries because we did not have sterilizer or autoclave to sterilize our equipments. But when they gave us those equipments, it has helped us to sterilize all our equipments, and we have conducted sterile supervised delivery at our facility, and this has prevented those puerperal services or infections that would have cost mothers their life and babies their life.
Pimaga Health Center in the Nipa Kutubu district was the only health center in both Southern Highlands and Hela to receive these items. Though it has only been 6 months, Pimaga Health Center has seen some difference with its statistics and referral cases.
It has done a big difference. It has reduced the number of infections, especially the mothers, postnatal mothers, as well as the newborn babies, where we haven't received any babies and mothers with neonatal infection and puerperal sepsis since we received kids.
Catholic nuns in that another Catholic establishment in Nipa Kutubu are also providing antenatal checks for mothers.
We be demonstrating how all use him. Time only go inside the place house Karen, and then before all deliver long and after the delivery, me must put him mama when the picking in lab. Now mama he must use him also. Now me demonstrating one nesi call it demonstrating. Now only must how use him na Olsem lo. Tupla halfway me looking long and Olsem me stop now only must use him this place. So me look stop now only use him this place. So I'm something where I'm helping me play, especially all mothers. Now all soap is stop inside long and how more stop. Me demonstrating all how lo soaking clothes blow picking how lo wash him, how lo look out him house blow all hygiene blow now let's play something. So I'm been this like kitty been helping me play good start long. I help him all mama, especially mama I got bear now mama I can't picking long.
Welcome back to Olsem Wanem. In concluding its humanitarian program, UNFPA also provided assistance to selected health facilities in both Hela and Southern Highlands provinces.
The work carried out by UNFPA in both Hela and Southern Highlands after the disaster has seen levels of improvements at the different health facilities. Either it was through the CMR training, those who received the kits and counseling, or the medical equipment which were presented to the health centers.
People don't talk about how to use the underwear or the pads, but then in the kit, it broke barriers like that. We had even male workers with UNFPA and the diocese. We have male personnel who do the demonstration, and that is a cultural breakthrough And another breakthrough is having young girls to know how to use the kids, because one day they will become mothers and they will have to tell their young daughters on how to be clean all the time. One of the things that we also see now is a lot of women coming with lower abdominal pain and diseases of the reproductive system. And that also has contribution with hygiene on how they keep themselves clean.
The general response from the communities that benefited and the health offices was the need for UNFPA to continue its work in both Highlands provinces.
I've been visiting all the facilities during the earthquake and during this time, and I've seen that most of the facilities have been down, been destroyed by the earthquake. But the support from our partners, the partners are our backbone. They're pushing forward the health services, and we know, as the CEO has mentioned, Dr. Brice has mentioned that there's always a gap in the government system. There's always political differences, but our partners are our backbone, and they've been supportive of so many support like polio campaign, now coming with this delivery beds, and I think. With this support, we are able to try and get our indicators to a better level.
During the visit of the UNFPA country representative to Southern Highlands, an additional 20 delivery beds, including examination lights, were distributed to both government-owned and church-run health facilities.
We've been, in our partnership with UNFPA, we've been able to do awarenesses and trainings in the areas of gender-based violence, which is such a very important issue here in the Highlands. Also the more trainings in the clinical management of rape, very serious and very important and timely trainings and awareness for our people that we ourselves would find it very difficult to be able to find the expertise and the resources to do for ourselves. And so it's because of our very valued and appreciated partnership with UNFPA that that our people have been able to participate and to benefit and to gain the capacity that is necessary to address these very important, serious issues that face our societies here in the Highlands.
What you are going to provide now is going to make a lot of difference to the people out there. And these people have been missing out on all these very, very basic services for a very, very long time through negligence, all these things. In terms of infrastructure, in terms of equipments, basic things. It's not been there.
While UNFPA has received some degree of success, it has also faced challenges in its drive to achieve its desired outcomes.
Challenges related to the conflict situation, challenge related to the earthquake situation where accessing some of the communities were so difficult. These are the most, the two key challenges that we had when we were trying to provide services to the communities. And we also had challenges related to the capacity, you see. So we train almost 200 people, 200 health workers and community workers for them to be able to understand and support all this process. And we believe that investment made will ensure sustainability for future. So yes, there were challenges, but we were able to overcome some of the challenges by working with the communities themselves who know better their own people for them to be able to provide them with the required services.
The partnership that now exists between UNFPA, churches and the government will be the same path that will be used to extend the work of reproductive health in this part of the region.
And that's all the time we have for this week. Thank you to all who have participated in this episode. And before we go, a friendly reminder, if you have any stories, comments or questions, please send it to us via the address now showing on your screen or post it on our Olsem Wanem Facebook page. Until next week, I'm Florence John Duo. Thank you for watching and have a pleasant evening.